A sitting member of Congress walked into that hearing room with a list, not talking points, not prepared speeches, a list of specific grants, specific dollar amounts, specific diseases. And she asked one simple question. Did you approve these cuts? Or did the White House? Robert F. Kennedy Jr. had every opportunity to answer. He had the entire weight of his office behind him, and he couldn't do it. What happened in that room is something most networks skipped entirely. Stay until the end, because the moment she reads the list out loud is the moment this hearing changed.
As the gentlelady from Arizona, Ms. Grijalva.
Thank you for your time today. I have to say, as I listen here, with all the health initiatives that you're espousing, I have grave concerns about the HHS bill, budget, and the cuts that are being proposed. I spent 20 years on a school board and saw firsthand how support systems children have or don't have outside of the classroom shape their outcomes. At the most basic level, children can't go to school if they're sick, they can't learn on an empty stomach, and their families can't get ahead if they can't access health care. I'd like to first talk to you about your proposed cuts to medical research. I was reading an article this morning that talked about your affinity to perform your own medical research. You apparently once cut the penis off a road-killed raccoon to study them later. You speak fondly of medical research, yet your budget cuts show that the National Institutes of Health are going to get a cut of more than 12%. This level of cuts would halt promising research, force layoffs of scientists and research staff, and undermine America's global leadership in medical intervention and innovation. What specific diseases do you believe deserve less medical research?
DEI.
Okay, so
We got $1 billion.
Do you have a specific program, a specific disease that deserves less funding?
I would say we're putting $1 billion into DEI, and DEI research has never cured any disease. It's never produced any new drug.
Okay, so between February of 2025 and April of 2025, HHS canceled or froze more than $180 million in National Cancer Institute grants. Were you the one to approve these cuts to cancer grants, or did that come directly from the White House?
We're giving the highest, one of the highest budget increases to NCI.
Can you just answer my specific question? Were you the one who approved those cuts, or did that come from the White House?
As I said, we are raising the budget for NCI, for the National Cancer Institute, in this budget. It's one of the only agencies throughout my, sub-agencies throughout my entire agency that's receiving a raise.
Okay. Let's be precise about what just happened. She named 4 specific cancer research grants: pancreatic cancer, cervical cancer screening, Arkansas Delta, each one cut. Kennedy's response to each one? We're raising NCI's budget. That is not an answer to the question asked. That is a redirect. And here is why that redirect matters. When an official responds to specifics with generalities, the specifics are true. He never denied a single grant was cut. He never said who authorized them. He never said those programs were coming back. The documents don't lie, and she brought the documents.
Okay, so Secretary Kennedy, you have the responsibility to tell the truth to this committee, and here are some examples of cuts. In April of 2025, HHS canceled an NIH grant regarding strategies to reduce cancer and chronic disease in the Arkansas Delta. In 2025, a grant selective targeting of pancreatic cancer was cut. In March of 2025, a grant, the automated digital imaging for cervical cancer screening. The list continues to go on. You've also noted that SNAP can be used to purchase whole foods. And when we look at some of the recent data, just in Arizona, the district that I represent, 424 fewer people, including 180 children, have lost food assistance since the enactment of H.R. 1. My constituents are writing to me telling me that they're hungry and cannot afford food. As the Secretary of Health and Human Services, will you make a statement here today that you oppose hunger in this country?
Well, I oppose hunger in this country, and we're the first administration to be doing something about getting actually good food.
Well, thank you. I'm grateful that you're standing against the Republican hunger cuts. And if HHS spends $21 billion on physician training, yet only 1% goes to community-based programs like teaching health centers that actually reduce primary care shortages. Why are we underinvesting in the models that work?
For rural health,
For community health centers?
I just put $143 million into community health centers for physician retention. We also put $50 billion into the Rural Transformation Process program, which has a lot of money for rural healthcare frontline physicians, to retain them, to keep them, to do residencies there. It's unprecedented.
So just so you know, only 1% of the funding that you've talked about actually goes to teaching health centers and community health centers, and health centers lower costs and improve outcomes
You asked
for
about the
Medicare
problem.
patients.
We're trying to solve the problem of rural residencies and rural access to rural personnel, and we're doing more than any administration in history to do.
So unfortunately, there are 5 rural health centers in Arizona that are at risk of closure because of cuts from this administration. So what are you doing to ensure that every Medicaid patient can access a community health center?
There's 39 million Americans in community health centers, and my personal belief is that it's the most effective health centers in our country.
Absolutely.
What they're doing is better than any, and we're making big investments to make sure that they continue. We've raised the funding in this budget for community health centers, and then I'm finding other pockets of money funnel, as I did last week, $135 million.
I would really like to see the data that shows that, because the rural health communities and health centers in my district are suffering greatly under this administration.
Well, I announced the program.
I yield back.
I announced the program in Arizona last week at a community health center.
6 more hearings. That's how many times Kennedy is scheduled to face Congress this week alone. Same questions will follow him into every room. Who authorized the cancer grant cuts? Where did that $180 million go? And why can the Secretary of Health not answer questions about children's health? Subscribe to Dana Weston Daily, because we don't cut away from the moment they can't answer. That's exactly when we keep the camera rolling. Drop a comment below. Do you think Kennedy will face harder questions in the next hearings? We read every single one.